Inspection, mental status. The method of inspection applies visual observations of the exterior of the body in order to deduce the state of the patient's health and illness. It focuses mainly on observation of the patient's mental status, coloring of the complexion and skin, general appearance, and the tongue. Mental status is the external manifestation of the state of the vital processes of the entire body. It includes the patient's vitality, consciousness, and thinking process. The mental activities are generated by the physiological activities of the visceral organs and are dependent upon the material basis of chi, blood, and body fluids. If the visceral functions are normal and chi and blood are ample, then the mind is vigorous. Conversely, if the visceral functions are abnormal and chi and blood are inadequate, then the mental status is abnormal. Thus, the normality and vigor of the mind is an important indication of body health. Mental status is reflected in the eyes, complexion, posture, speech, and level of consciousness. But because of the most intimate relationship between the eyes and the visceral organs, the most important aspect of assessing mental status is the observation of eyes. Mental status is generally classified as vigorous, lethargic, or pseudo-vigorous. Vigorous mental status. Vigor reflects ample vitality, chi, and essence. It is seen as bright and lively eyes, a radiant complexion, natural and relaxed expressions and posture, alertness, smooth movements, clear and coherent speech, and mental clarity. Vigorous mental status indicates that essential chi is ample, the constitution is strong, and vitality is full. Even when the person is ill, it indicates that essence and chi have not been damaged, the visceral organs have not been injured, and the prognosis is excellent. Lethargic mental status. Lethargy is a sign of exhaustion of essence and deficiency of chi. There are a variety of characteristic symptoms, such as dull eyes, slow and awkward movement, blurred vision, dull complexion, and facial expression, heaviness of the body, and sluggish responses. In severe cases, there may be confusion, delirium, or hallucinations. Lethargic mental status indicates that genuine chi has been damaged so that essence and chi are both depleted and all functional activities are depressed. Clinically, it is a sign that the illness is grave and the prognosis unfavorable. Pseudo-vigorous mental status. This is a false and transitory improvement in mental status when the illness is critical. It is often seen when death is imminent in a patient who has been seriously or chronically ill with exhaustion of essence and chi. The patient suddenly shows mental alertness, bright eyes, clarity of thought, though often restless or agitated, desire to sit up, talkativeness, though often with simple and repetitious content, a louder voice, flushed cheeks, and appetite. Pseudo-vigor is thus an abnormal sign in a patient whose visual essence and chi are on the verge of collapse and the vestigial yang is about to disperse. It must be distinguished from real improvement in the illness. In general, pseudo-vigor comes abruptly and is transitory. Its features do not match the patient's general condition. The ancients compared it to the flash of brightness of a lamp just before it died from exhaustion of the fuel. Thank you very much for your attention.